Exciting day today. We're introducing Dr. John Berry to the viewers of my YouTube channel and Instagram channel. Dr. Berry, welcome.
Hello.
He started out as my anatomy and physiology teacher. And then we progressed as friends, and now we're working together. And he'll be part of the Efficacy training system team on Tuesdays and Thursdays, providing people with chiropractic care. So starting off, can you tell us a little bit about your educational background and what made you decide to get into chiropractic medicine?
Well, I graduated from Palmer College of Chiropractic in 1998. That school is in Davenport, Iowa.
Mm-hmm.
Before that, I went to 4 years of undergraduate school at West Liberty University, which is in West Liberty, West Virginia.
West Virginia. I always thought you were Canadian.
Yeah. She's a 53-year-old female right home.
And last time I checked.
her main complaint is of neck pain. She has spasms in her neck. She has migraines occasionally, ocular migraines. And she also is complaining that she has some pain in her low back, and that she's occasionally having some pain radiating down her leg into her foot. So what I'm going to do today, she has been to a chiropractor before.
Mm-hmm.
So, this is nothing new to her, but I'm going to explain to you like it's the first time you ever heard it. So, all right, we're going to start you with your face down in the tray there, Holly.
Mm-hmm.
All right. So, a chiropractor, I was asked to explain what chiropractors do. And chiropractors work on joints at the fundamental level. At the fundamental level, we work on joints. And joints need to be freely moving. All right? You never want to have a joint that's stuck. Is that Trumpish? You never want to have a joint that's stuck. I don't even watch TV. All right. So what I'm doing now with Holly is I'm looking at her leg lengths. All right. And most people, you may think that your legs are the same length, and they probably are, right? Usually, if you have a leg length, or your friend or somebody who went to a chiropractor and they say one leg's shorter than the other, usually the result of having one leg appear shorter than the other leg is because of a misalignment of the pelvic, because the leg comes up and connects into the pelvis. So if the pelvis is twisted, it's going to affect what we're looking at in the leg. So we look at the legs, and they should be about equal. And we look to see any rotation in a normal setting, if there's any rotation in the ankles, if there's any pronation or supination, if the ankles are twisted. And usually that's a very good indicator of some tight muscles if you have that issue in the calf. Does that feel a little tight there?
Yes, it does. It does, right there on the side.
Yep. So, massage and chiropractic go hand in hand, because I can move joints around, but if the muscles are tight, if the muscles are constantly pulling, everything's just going to get pulled out of place. All right. So, it's best. Chiropractic's great, massage is great. I highly recommend both of them. But when you can get them in conjunction, I think the results are very good, very good. All right. So, looking at this pelvis, or looking at her feet, and looking at the pelvis looks pretty symmetrical. There is a little bit of a hump. It does look like it's rotated a little bit out. So the table Holly's lying on is called a drop table. And Holly, this table is going to, when I push on your back, it's going to drop like that. Now, are you familiar with that?
No, I've never been on a table like that.
Okay. So there's a tension rod here, or there's a knob. Let me just explain. So there's a rod here that I need to get the pressure right. And it's a table, and not everybody's the same, so we have to adjust it. I don't want it to fall too easy, but I don't have to. I don't want to have to also push through your back. There we go. That should be perfect. Hey, Holly, why don't you take a deep breath in for me? You go ahead and let it out. Get a little bit more than that. How's that feel? Did that feel okay?
Yes.
It didn't hurt me a bit. Waka, waka, waka. All right. So now, working our way up, we're going to work on her peroneals today. Working our way up. You know, again, we look for any muscle imbalances in the spine. We have a group of muscles that run up the spine. They're postural muscles. They're called the rector spinae muscles, and they have lots of connection points along the vertebrae of the spine. There's also little tinier muscles in between each segment, but we really like for these big muscle groups to be balanced. All right, so what I'm doing now is I am feeling how the segments interact with one another. I'm also feeling for any of these tiny muscles. Like that's a little knot in there, right? Definitely when you get in here, feel these little knots that you might not know about, and we feel and make sure these segments move. Again, if a segment is stuck, then it's going to get arthritic, and you might not even know it's stuck. That's the one of the interesting concepts in a way, because of the way the spine is built, is that if one segment gets stuck, then the segment above or below will tend to become a little bit more mobile. Does that make sense? So we want to get these segments that are stuck unstuck, and that's going to increase the flow of oxygen and nutrients into that joint. Joints are lined with cartilage, and cartilage, a lot of people know or might have heard that like cartilage doesn't heal very well. The old saying, you know, you're better off breaking a bone than spraining your ankles and things like that. All right.